Hello, my name is Dr. Costello from the Harvard Veterinary Clinic, and this is Stacy. She's one of our veterinary technicians at the Harvard Veterinary Clinic, and this is her dog, show dog, Vinny. And Vinny is going to be our subject for a demonstration of an ultrasound. We're going to try and find out if Vinny actually has all the things that make a dog a dog. We're going to look to see if we can find Vinny's kidneys on his ultrasound. We're going to take a look at Vinny's liver. All these things play part in some of the methods by which we go ahead and determine animals' health at the Harvard Veterinary Clinic. The ultrasound is, of course, a non-invasive tool that we use to go ahead and check for various problems, such as bladder stones, bladder cancers, infections, pregnancies, prostatic inflammation, splenic tumors, splenic nodules, and various other forms of abdominal and thoracic disease complications that we can see in any of these animals. So we're going to start off with Vinny here, and I think Vinny's going to go ahead and be a real nice dog. And he's moving his foot there. So we're going to go ahead, and as we can see, Vinny has a very large urinary bladder. Vinny, being a male dog, is probably going to use that like a weapon. But we can see that Vinny has a normal urinary bladder, as we can see on our screen. That is the dark spot there. There's no sound echoes passed back by the fluid within his urinary bladder. Let's move farther forward. Go ahead and we can check out Vinny's spleen. Now we're going to go, there's Vinny's kidney. And once again, we can check out the kidneys for the appropriate, what they call echogenicity of the kidneys. We can check for evidence of chronic disease in the kidneys. We can find stones in the kidneys. We can find birth defects, congenital abnormalities. We can measure their size. We can measure width, length, and volume of these guys to go ahead and make sure that Vinny has the appropriate size and function of his kidneys. It's all part of a good exam on these guys whenever we find that there are issues going on there in their abdomen. We'll also check and see if we can find Vinny's liver here. I don't know, Vinny, has he got a liver? I hope Vinny's... Oh, Vinny's good. Vinny's cooperating here. So I try and get my probe to go ahead. There's Vinny's spleen. Vinny has pretty much a normal spleen. There's Vinny's liver. And if we look on the far end of the probe, we see Vinny's gallbladder coming into focus. And Vinny has a very full gallbladder, and he's waiting for dinner. So, we're going to go ahead, and that concludes our ultrasound demo. I'm sure Vinny's probably enjoying getting off the table more than anything else. But, once again, we do, at the Harvard Veterinary Clinic, use the ultrasound as another one of our added tools, in addition to things such as your blood tests and your x-rays, to go ahead and monitor the health and well-being of the patients that we have here. Right, Vinny? Smile for the camera.
Yeah.